Good morning all. How are you? Hope you are all doing very well. We talked previously about the application in the clinical area using the electronic health records. Today our lecture will be about the clinical practice application in the community base. Before we start, would like you to look at this picture. Please, for your safety, don't text while driving or walking. It is highly dangerous. Now, our outline is Introduction, Role of Informatics Nurse, Automated System, Telecommunications, Challenges. In addition, factors influencing telehealth development, telehealth components, specific telehealth applications, challenges related to telehealth, future direction and summary. Community care is fast growing in healthcare, and the healthcare system is changing and reformed. Do you know what is the meaning of healthcare reform?
Yes, doctor. Healthcare reform meant to decrease healthcare cost.
Yes, doctor. Also, healthcare reform meant to decrease in the number of hospital beds.
Also, it means increase in home care.
In addition, healthcare reform means increasing in community health promotion and illness prevention programs.
In this context, do you know what is the role of the informatic nurse? How nurse informatic play an integral role in facilitating community-based care? We'll tell you. Many community organizations have information systems that mirror those of hospital facilities, thus the automated system plays an important role in helping the informatic nurse in this role.
Yes, doctor, and in this context telecommunication would help. Am I right?
Yes, you are right. Do you know how?
Yes, doctor, I know. The linkage with telecommunication provides the greatest gains in applying informatics to the community setting. Similar information are needed by the nurse in the community and in the hospital to deliver the required care, as demographic data, past history and diagnosis, lab treatment. Also, delivery of care is facilitated by availability of teaching materials, policies, procedures, drug and treatment information, technical data, community services listing.
What you mentioned all is totally right. However, there are many challenges. Do you know what they are? We said that same information is needed in the community and hospital setting. The problem is that the patient's medical record, policy and procedure manuals, teaching materials, and the clinical reference books are inaccessible, because they are kept in the agency offices. Another problem is the key missing link in community-based care, that is collaboration with a multidisciplinary health team during delivery of patient care. Who would be responsible if something happened to the patients? So, in your opinion, what would be the solution? The solution is the telehealth. Telehealth offers technological and information systems solutions to many of the challenges of community-based nursing practice. Telehealth. It is the use of telecommunication technologies and computers to exchange healthcare information and to provide services to clients at another location and distance. Previously it was known as telemedicine. With telehealth, client can get the treatment while they are at home. Telehealth makes communication between healthcare providers easy, whether they are in different places at the hospitals or in different countries, especially when there is shortage in some specialties. For example, in Jordan, at Al Mafraq Hospital there are shortage with some specialties. What they do is that to connect through telehealth with another hospitals as Hamza Hospital in certain days, so client would take the proper treatment. When we were students we used to attend the open heart surgery from the Mayo Clinic in the United States of America. Telehealth though is playing an important role for individual health. What do you think? What are the factors that influencing telehealth development? The first factor is the needs of aging healthcare consumers, have initiated efforts to develop and adopt better telehealth systems. The second factor is cost containment. Healthcare costs a lot. Telehealth systems are facilitating redistribution of healthcare services, reducing duplication, and would reduce the numbers of drug interactions. The third factor is the access to the healthcare services. there is increasing demand for equitable access to healthcare services for people of isolated geographic areas. Do you know other factors?
Yes, doctors. The other factors also include: fourth factor is technology. The availability of powerful technologies and communications bandwidths are becoming available at decreasing costs, which make the application of telehealth easy. Fifth factor is demand. The increasing consumer demand for wellness and health information of all kinds has fueled increased access to the internet. Factor number 6 is information explosion. The increase in medical and health information has given rise to demands for better information management systems, faster and more efficient electronic access, and better online research network.
The technologies and systems used for telehealth differ greatly from one application to another. However, each application, even the simplest, contains 1. A device or means to capture, process and store content, input, whether sound only, electronic or digital images, tracings, alphanumeric data, or a combination. 2. Content and a means to transfer or exchange the content, throughput, communications, telecommunications, or network technologies of all kinds and their associated software. 3. A means for receiving, storing, and displaying the content, output, possibly a video monitor, a computer file server, or a recorder of some kind. There are many examples of telehealth applications. Be careful, there will be a question in the exam. An example is, instead of using face-to-face communication, with telehealth we use video conferencing, computer-based email. Another example is, instead of the physical transfer of any medical image, with telehealth there is electronic transfer of images. You can see other examples in the table. There are also specific telehealth application, that is specific people are using. Also expect this as a question in the exam. For example, all forms of healthcare at a distance, teleconsultations, telepathology, teleradiology, telecardiology as telehealth application can be used by physicians, nurses, other healthcare professionals, healthcare institutions. Another example is the use of tele-education and multimedia applications for health professionals and patients and networked research databases. Internet services can be used by healthcare professionals, patients, and consumers, universities and colleges. Other examples can be seen in the table. There are many challenges related to telehealth application. The first one is obsolescence. Many of the technologies have a short shelf life, which is a major concern for managers and administrators.
Yes, I know other challenges, doctor, that include interdisciplinary and inter-institutional collaboration, conflicts between institutions and physicians, nurses, pharmacists, radiologists, must be resolved of who will be responsible. Documentation standards. Telehealth documentation standards must be developed for use by all providers to ensure a useful PT record. Data security, confidentiality, privacy, and security issues related to the collection, storage, and transmission of patient information, which must be resolved. Liability issues, medical and nursing responsibility issues related to continuing responsibility for a patient's care.
Dr. It is important to know also that the development of telehealth services is creating new areas of specialization within the healthcare disciplines.
Yes, Ahmed, that is right. The telehealth services include health promotion, disease prevention, diagnosis, consultation, education, therapy, decision support. Be careful, it can be a question in the exam. There are some related terms to telehealth that include telenursing, which is the use of computer technology and telecommunications for the delivery of nursing care. E-care, it is the provision of health information, products, and services online, as well as the automation of administrative and clinical aspects of care delivery. E-health, it is a term that used interchangeably with e-care. Nursing telepractice is another nursing-specific application of telehealth that includes all client-centered forms of nursing practice and the provision of information, conferences, and courses for health professionals occurring through, or facilitated by, the use of telecommunications or electronic means. Now, do you know the delivery mechanism of telehealth? I mean how telehealth services could be delivered?
Yes, doctor, that includes teleconferences and app video conferences, which is the predominant methods to deliver telehealth service. Also remote monitoring, another mechanism.
The driving forces for telehealth include patient safety, which is the most important one. Cost containment, that is, telehealth will decrease the cost of care. Managed care, while the patients are at home. Disease management, especially for chronic diseases. Emphasis upon keeping an aging population functional in their own homes as long as possible, without coming to the hospitals. Means to improve access to care, for all patients regardless their location. Means to improve the quality of care delivered. Means to deal with shortages of certain types of healthcare providers.
Many issues of telehealth include need for technical support, lack infrastructure, accreditation and AMP, regulatory requirements, homeland security, limitations, lack of funding.
Nursing role in and uses of telehealth is found in a variety of applications including call centers and telephone triage, specific disease management, community health, follow-up calls, education, consultations, patient assessment, and electronic house call. Future directions. The future directions of telehealth is that the telehealth is expected to change the way that healthcare is delivered and create new roles for providers. Also, the role of the healthcare consumer is also evolving with the development of telehealth applications. Moreover, telehealth offers the means to help and keep an elderly population independent in their own homes. As summary, the development of inexpensive, reliable telecommunications technology enables health professionals, patients, and consumers to access health information, healthcare resources, and health service directly from and in their homes. The networks serve as educational vehicles whereby nurses can reach patient and clients with health promotion, disease prevention, information, illness management, and nursing intervention. Nurses can use technology to assist them in providing home care and in-home monitoring. Telehealth applications exist as discrete nursing interventions, and provide pathways for nurses to reach patients and provide nursing intervention. Thank you. Any question?